Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot.
And today, I'm delighted to be joined by Pennie Sempell. She is the co-founder and CEO of StressPal. Pennie, thanks for joining me today.
Glad to be here.
So, as I do always as part of my show, I like to establish people's background. You've got an interesting and unique background, certainly in the healthcare space, of somebody that's focusing on the area that you are. Obviously, stress, given the name of the company. Tell us a little bit about your background and how you arrived at this point in your career.
Sure. Okay. Thank you. Well, I have actually been involved in integrative health advocacy and self-care education from the earliest days of mind-body medicine. I was a graduate from UC Berkeley in psychology, and I was teaching guided imagery, meditation, biofeedback at a psychotherapy clinic in San Francisco. I went on to law school, and there as an attorney and a mediator, I continued to see up close the impact of stress on psychological and physical health and on relationships, both family and work. This led me to explore advanced training in conflict resolution, mediation, and a variety of mind-body approaches to health. I developed courses for attorneys. I started then I became involved in a 20-year collaboration with physicians at a medical center here in San Francisco, where we pioneered complementary and alternative medicine approaches to self-care, particularly focusing in that extended period of time on patients with chronic stress-related diseases. And of course, in that capacity, I had a chance to both see the rising caseloads that doctors were faced with and the lack of evidence-based materials to help their patients with chronic stress-related conditions. I collaborated and teamed up with my co-founder, Jim Monroe, a PhD in clinical psychology, and a broader team of physicians and nurse advisors. And together we spent the next 4 years developing the research and development for StressPal and patient-facing tools and this clinical tool, StressPal Frontline, which is now available.
So what led you, as you sort of navigated from psychology, the stresses, mediation, into the healthcare space? What sort of drove you along that direction? What came about, and what sort of what were you seeing that launched you into this focus?
Well, I think I've always really had a fascination when I've looked back at this about myself. I've had a real interest in how do we take chaotic, conflictual situations and bring about a harmonious and a resolution. And for a number of years, I actually did both. In the 90s, I was both practicing law and I was focused on mediation. And I was starting to become involved on a grant at Cal Pacific Medical Center to work with ICU patients getting heart transplants. And we saw how effective these complementary alternative modalities were, even with ICU patients in these critical conditions. That led to physicians asking me to join their practice. That led to the next couple of decades. So we really pioneered, how do we support physician care on the patient side with patient engagement in self-care around lifestyles and integrative health concepts.
Right.
So I just found that's my passion, that's my love. So when I teamed up, I see myself as having the strength on the education side. How do we bring the evidence-based concepts and traditional concepts to the fore? How do we make them fun and engaging and efficient? Because there's such a lack of resources out there for people, particularly that are private and secure. And that's a big point for us.
So I would say interesting. You started with patients, but I think your primary focus now is around the healthcare providers and the teams, or does it extend past that into the patient community as well?
Oh, yes. The StressPal Resilient is the name of the tool that's continuing in development. That would be a clinical adjunct tool. So if you're the provider that's on your dashboard, it's one of the tools. Joe comes in with hypertension. You say, hey, Joe, in addition to your meds, we'd like you to get started on our stress resilience training program. It's an in-house tool with the assessments provided to the clinician. So that tool is in development. We hope to have that released about this time next year. So it's an expansion. It expands this concise program that we've developed for clinical care teams and healthcare leadership. So this is a condensed, kind of a little bit more tight pace, but the same concept.
Right. So as you think about the sort of the setting of the healthcare world, we've seen this huge increase. I think just based on some of the things that have happened over the last several months, I think many people are certainly familiar with other meditation type apps, the Calms, the Headspaces, Nirvana, and so forth. And I've certainly talked about those. It's, some of the things that I use and sort of advocate. Help the listeners understand, because I think this is slightly different. What is it that they do, and what is it that you do, and how do you sort of separate out the sort of the functions and features, as it were?
Okay, thanks for that question. So, mindfulness and meditation have been the subjects of study, and they're in some of these popular apps that are out there. But there's an extensive body of research around therapeutic modalities that really help support this concept of psychological flexibility and resilience. And these cognitive behavioral therapy and mindfulness-based therapeutic modalities like acceptance and commitment therapy have been well researched as looking at how do we really help protect and rebuild this complex phenomena we call psychological resilience. So I would say that one of the important ways in which we are moving forward is by integrating these leading mindfulness-based therapeutic model of acceptance and commitment therapy in an innovative way with cognitive behavioral therapy and mindfulness meditations. So it's all in one package. So in our program, we're doing this incremental training, like 5, maybe 10 minutes a day, most days, over a period of about a month. It's a self-paced course with ongoing mindfulness meditation supports ongoing. So we're putting that all together, both in a training model and in a stress resilience support model. We're also, importantly, making this private and secure. So there's no sharing of personal data. There's absolutely no sale of personal data. There's no upsells. This becomes a tool within the organization that the organization can use with its teams. And we use pre and post assessment. So that's another way that we're very different from popular apps out there. So we've got the privacy. That's huge. Only 4% of behavioral health apps out there, or even less than that, are really strong in terms of their privacy standards. And the privacy, the training model, and the being available as a tool that has metrics that are, again, anonymized to the organization and shared with the individual. So the privacy extends there too. So we're tracking outcomes and providing that information to the individual and in the aggregate to organizations. So it's a bit different model and a different way of providing information. Both the common areas that mindfulness meditation would be a feature in both programs and the dominant feature in the apps. Does that help?
So thinking about that and the current rise that we've seen, I think it's unquestionable. We've seen this huge increase in stress, burnout. We've been talking about burnout for physicians for as long as I can remember. Well, actually, we didn't use the term, but we've certainly been talking about it. What is going on, and why do we have such a problem with this, particularly in the healthcare space and with healthcare providers?
Okay, well, we were being both Dr. Monroe and I have several decades of work in multidisciplinary clinics, and his expertise is really around psychological medicine and the stress resilience piece. And we both observed in our independent practices the rising pressure, system drivers of burnout for physicians, and one of which was the rising caseloads of stress-related disease. But there's all, very much so, the administrative burdens, the electronic health record technology burdens, and of course, increasing in financial burdens, issues with payers. That preceded this pandemic. And we were already seeing, disturbing levels of symptoms of burnout in clinical care teams. Of course, the infection fears and the new strains around finances are significant in this past year, and I think have really pushed it to the point where there's an awareness among physicians who are, by the way, very highly resilient people. They're above average. Studies have been done on levels of resilience. Resilience is something that can be measured and assessed. But we run into the problem that the human brain is activated by these persistent stressors, these adverse conditions. So even if you have inherently higher levels of resilience, these highly pressured and persistent external environmental stressors will start to erode that flexibility. And the brain starts activating stress-triggered thoughts, feelings, behaviors like irritability, errors, and physical responses. And all that's happening in response to these rising stressors in the healthcare environment. So therein lies another area where we really feel we are helping to differentiate in terms of, by making this tool available to your teams and to management, you can start improving the capacity to have collaboration around solving some of these complex drivers of stress. And every medical center is going to have its own situation, how it wants to approach it. But under the high stress environment right now, if you can start to alleviate some of that and provide some deeper levels of improve resilience across the board, you're going to start having more effective creativity, problem solving, and collaboration, which are known benefits of resilience, as well as all the physical and behavioral benefits of resilience.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Pennie Sempell. She is the co-founder and CEO of StressPal. We were just talking about the impact of burnout, the increase in burnout in the current environment of COVID-19. Importantly, as you rightly point out, this infection fear that's been added to all of the other things that existed before. But you made an interesting point. I'm curious to understand why. You said, physicians are more resilient. What is it about them that makes them resilient? What's going on with the clinical team? I mean, that's good news. It's obviously not good enough because we're still being burnt out and, struggling with that.
Well, resilience is a complex phenomenon in the brain. And I think one of the misconceptions in the general knowledge around this is that resilience is something, there is an inherent quality, but we also can improve our psychological resilience and we can protect it. Conversely, it can also be worn down and eroded. So people who track into medicine are going to likely be more inherently resilient, psychologically resilient. That doesn't mean that other people couldn't develop that resilience and then also undergo the rigorous training that is required to be a physician. But we might think of, there's an analogy I'd like to share. If we can think of resilience, this complex phenomenon in the brain that's about how the brain first perceives and then instantly responds to the stress triggers in the environment. And how do we adapt? How do we learn from? And how do we recover? That's really the training around resilience, is those first perceptions and reactions. And in the more resilient brain, that will de-escalate the stress response and the action of the amygdala in the cortisol response and the cascade of hormones that follows. So if we can protect that capacity from the erosion, if we can provide these daily, small, in the moment, in the heat of the moment, under the stressor, strategies that are well studied in psychology, bring them over to medicine here and help clinicians learn these strategies, it becomes something like, brushing your teeth. It's a quick thing. It doesn't require sitting down and stopping what you're doing. You could actually, in the moment, take these cognitive strategies and apply them right then and there.
Fascinating. I mean, I'm thinking about that, as I sort of ponder, super stressful moments from my past medical career. And of course, the first thing that springs to mind is codes, patients, in critical condition and the enormous stress and the decision making. And I'm thinking about how you would apply that. What are the sort of approaches in that moment where you have a tsunami of inputs that are coming from people, from machines now, from, all around you. What are the sort of approaches that you counsel and are supported by the evidence that help people sort of navigate that avalanche of information and stress?
That's a great question. When we look at the mindfulness-based therapeutic model of acceptance and commitment therapy, which is the core of our training program, it's going beyond present moment awareness, which we often think of with mindfulness-based approaches, to get into a very practical application and we've refined this, what we call the 3 mindfulness reflections models. It's the core of this training. Very easy to remember. The first step is cultivating, which is happening over the course of, these weeks of our training, cultivating an awareness, the capacity to be aware in the moment of your stress-triggered thoughts, feelings, behaviors, how you're acting or behaving, and your physical responses. Is there a headache rising? Is there a stomach ache? What are those thoughts, feelings, behaviors? Then to cultivate an awareness of whether these stress responses are helpful and useful to you. Is that response actually helping to what you value, what matters to you? And you're learning, in these little practice interactive steps that we provide, you're learning how to cultivate the capacity to become aware of that awareness of the thoughts, feelings, and such, whether it's useful or not to what you value, which we then, you need to take a little moment here to really, to learn. In the learning process, you're learning also how to reflect on what is important to you and what you value. And the third step is being flexible to act on a more workable strategy. So, of course, you need to know what those strategies are. And there are some very well-studied cognitive strategies that you apply in a moment. So we're really harnessing the extraordinary capacity of our creative brains to be able to, in the moment, hold these levels of awareness, bring forth these more sophisticated levels of awareness that are very personal to our salient thoughts and feelings and responses to stressor. And in doing that, we're engaging a different part of the brain in response to the stressor. And we are not responding with that big, we're de-escalating that stress response. So that's the core of the training.
You've had lots of experience with clinicians. You've got this body of knowledge. You've been working for a number of years. Can you share any stories or specific examples of that in practice and how that sort of played out for individual physicians or even groups of physicians or, clinicians in general? What's been some of the sort of positive outcomes or experiences from that?
So what we can see here is that the situation, the external environment, is not likely to be changing anytime soon here. But what we hear from, what the research shows, what our own clinical experience is evidencing, is that when you refine these capacities, these levels of awareness, these mindfulness levels of awareness, and some of the other cognitive behavioral strategies we bring in around behavioral strategies, when you can call those forth in the moment, you find that you are able to feel that you have more capacity to bounce back, that you're able to start utilizing these. Of course, over time, we get better, just like practicing meditation. So we're in this condensed program. We're teaching you these capacities. You within that month period of time or so, it's a self-paced program, so you take the time you need. But with that and the ongoing support, you're going to get better and better. And this is the report we hear, is that capacity to feel that you are taking better care of oneself is a little bit too, vague, but But
well, no, it isn't. I think that's a great. Actually, if you can't take care of yourself, how can you take care of other people? So
yes, it's taking care of oneself in a complex way, and it's really at the level of what's important to you, what matters to you. It's highly personalized. The way we've developed this program, it's customized at every step. So it's really about your own personal values, your own personal goals and thoughts and feelings, and that's why it's going to be, very much how you then apply that in those situations that stress those very things that are important to you. And how you, I think one of the things that we've heard back consistently is that I use this all the time. I use these thoughts, these strategies pop in my mind. And what the trajectory that we want to see in this incremental learning is that initially these may seem like, what, really? Over time, you start to notice that it does pop in your mind. And it's that cognitive shift that happens in your navigating these adverse situations that becomes very important. And we work to cultivate that in the way we structure, we call it life practice in our program.
So in the closing minutes, as you think about going forward, we've obviously had this sort of big inflection point around COVID-19. It's, layered on additional stress. I think I don't want to say widespread acceptance, but there's certainly more awareness of, the challenges. Do you think we're sort of turning the corner of just general acceptance that this is not the stigma that's normally associated with, our inability to cope in these circumstances, all of those sort of drivers? Do you think we've made progress, and where do you think we're going in the coming months?
Well, these stressors have been extraordinary, and I think the thing about medicine that needs to be acknowledged here is that it is one of the most inherently challenging and unpredictable work environments. So, hats off to everyone in healthcare. If we can start to see what we would like to see is that organizations, health or care organizations, are robustly ramping up, and we feel we can be of great help to that with our really low-cost tool to really ramp up cultures of resilience to support wellness in this very challenging profession that is healthcare. And we're going to face ups and downs, of all kinds. No one feels that more acutely than healthcare clinicians, and I think non-clinical teams too, management too. So I hope we see across the board that there's a robust ramping up of support and both personal resilience and for tackling the system drivers that drive burnout. And I think they work together. I think there's an interrelationship there, and we'd like to be a part of providing a low-cost, effective solution.
Fantastic. So ultimately, this is an ongoing problem. We've got to sort of continue to focus and address on it. We've got to accept that this exists in, the healthcare settings. The good news is that there are solutions based on what you've shared with us, and certainly your experiences and some of the reports from, your user base and people that have accessed this. I think the important thing now is to get the word out and to start to address some of the stresses that we can change. So hopefully we're going to change some of those, but those that we can't, focusing on our method of dealing with them. And I think this sounds like a great way for folks to really start to think about that. So as we have most weeks, unfortunately, we've run out of time. It just remains for me to thank you for joining me on the show today, Pennie. It's been a great discussion.
Thank you so much for inviting me. I've enjoyed the conversation.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at Dr. Nick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com, and tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.